Hi there, my name is Mike Sullivan. I'm the Program Director of Valor Medical Services. I'd like to welcome you to this presentation from our series of continuing education for pre-hospital providers. Now, before we begin, there's a few things we need to go over. First off, the information presented in this program is intended for use by trained EMS providers. Also, due to variations in protocols and scope of practice among different states, departments, and agencies, this program may discuss or depict procedures, medications that are not acceptable in your daily use. If you see something in this presentation that varies from your agency's policy, always follow your department's protocols. Also, none of our authors or presenters of this program have any conflicts of interest or financial relationships they need to disclose. We do have documentation of this on file available in our office upon request. While we do our best to make sure that all the content we present is the most current available, participants are reminded that medicine is indeed a dynamic science and thus changes rapidly. So things may have changed since we've written or compiled this program. Please always follow the most up-to-date information available. In closing, if you have any questions about this or any of our other programs, please email us at info@valormed.net. Thank you very much and welcome to the program. Alrighty, now that we've got all that legal stuff out of the way, before we get started, let's talk about coffee for a second. If you're looking for a great cup of coffee, you probably want to check out coffeebrandcoffee.com. They're an online retailer, American owned and operated. They have a wide variety of coffees, teas, hot cocos, all sorts of different flavors. They've got all sorts of organic teas. You can get coffee in bean form, ground form, K-cups, whatever your heart desires. I've had several of the different blends and several of the different flavors. Absolutely fantastic. And because they are an American-owned small business, they don't have a big warehouse, so they don't have a big supermarket sales business. They roast it, they bag it, they ship it to you. It'll pretty much be some of the freshest stuff you'll ever get. Definitely highly recommend them. And they've got a promo code out for us now. If you use promo code VALOR SDS, you get a 5% discount off any order. So you can save a little money, try some fresh coffee, see what you like. They've always got different flavors coming through on their website. Some are permanent, some are limited time only. And if you look right there in the picture, you can see they've even got, yes, double caffeinated. Definitely a winner around this office. Alrighty, now let's get to class. Hi there, my name is Mike Sullivan and I'm one of the instructors at Valor Medical Services. In this program, we'll be discussing HIPAA. Now, we put this course together because HIPAA is one of the often talked about but most misunderstood things that we hear about with EMS. And so we decided, let's go back to basics and cover what actually is HIPAA, where did it come from, and what does it mean for us. Now, in this course, we're going to discuss the origins of HIPAA. We'll give example of what some violations or potential violations are. We'll recognize what PHI is. We'll discuss some of the steps to prevent inappropriate disclosures. We'll determine when it's appropriate to disclose information and how. We'll summarize the rules regarding the notice of privacy practices and identify correct methods to share protected health information. We'll also take steps to describe the steps to take in case of a breach. Now, before we get too far into this, I will say that I am not an attorney, nor are any of our staff. However, we have taken numerous HIPAA courses and also gone through several excellent privacy officer courses, learning about HIPAA and the history of it and how it all comes together. There's a lot more information about HIPAA that can actually be covered in this course. However, this should give you a good baseline idea and possibly some action items that you can take back to your organization or agency. Now, HIPAA in and of itself is an acronym for the Health Insurance Portability and Accountability Act of 1986. If you look real closely, there is one P, it's in portability, and two A's, Accountability Act. Please, if you're going to quote HIPAA, cite HIPAA, or talk about HIPAA, especially on social media or anywhere else, please make sure you're spelling it properly with one P and two A's. That's one thing, it's a little aside, but it's a personal pet peeve. When I see people on the internet talking about HIPAA and they haven't even spelled it right, it kind of makes me wonder how much they know about HIPAA. So remember, please, for your own credibility, 1P, 2A's. Thank you. Now, HIPAA was a federal law. It's passed in 1996, and the enforcement actually didn't begin until 3/1 of 06. They gave us 10 years to get our act together and get things in place. And then they expanded and widened the enforcement in 2013. And that was largely due to some of the issues they saw when enforcement began in 06. They implemented major fines for violations. It's a federal law. HIPAA is not just something nice that we talk about or think about or hear about once a year in an in-service training. HIPAA is a federal law that governs things that we should do and should not do on a day-to-day basis. But why do we need HIPAA? Why was it created? Why was it born? Honestly, the concept of patient privacy is way back before HIPAA. If you go to the NAEMT oath, which was out for years and years before HIPAA, the concept of patient confidentiality was in there very loud and clear. One of the lines of the NAEMT oath was that we should respect and hold in confidence all information of a confidential nature obtained in the course of professional service unless required by law to divulge information. Now, I went through EMT school back in 1992. We learned all about confidentiality then. Basically, what the patient tells us in confidence, we cannot share with anyone else, whether it be their family, their neighbors, the person up the road, our friends, our buddies, whatever. That was confidential information. We always knew about confidentiality. So why did we need HIPAA, and what did it change with HIPAA? Well, part of the big change was HIPAA put federal law and fines behind confidentiality for us. After all, it's one thing to say that confidentiality is something as a core tenet of our profession, and some confidentiality is a best practice, and we all support patient confidentiality. It's another thing to say it's federally mandated under law and under federal penalties. So therefore, it basically did nothing but put into federal law something that for us had been a general practice up until that point. There was also a lot of other parts of HIPAA. If you look through the actual law itself, there are 5 separate titles. Title I deals with healthcare access, portability, and renewability. It talks about how you can continue health plans under COBRA if you leave a job, how you should be able to transfer healthcare between one entity and another. Title II gets into preventing healthcare fraud and abuse, deals with administrative issues, and also some medical liability issues. Now, Title III is tax-related. Health provisions governing medical savings accounts. Title IV gets into application and enforcement of group health insurance requirements. And Title V, revenue offset governing tax deductions for employers. Does any of this really apply to EMS? Well, yeah, it does. And the big one for us is Title II. And that deals with a lot of patient information. In our section, so to speak, Title II, it defines who the law applies to and what a covered entity is. At the simple version, a covered entity is any entity or organization that bills Medicare or Medicaid. So, if your ambulance service or transport service or whoever, or your hospital or your clinic bills Medicare, Medicaid electronically, therefore you have become a covered entity. It also talks about how covered entities under this umbrella can bring other entities under it with them by information sharing and different business agreements. So, for example, a provider who is a covered entity, they may have a billing company or a third-party outside billing company, and that covered entity will bring the business associate under the same umbrella. It's really a lot of legal mumbo-jumbo, but what it says is Even though ambulance service A is the one who gets the information, billing company B gets it from them, and so because the ambulance service shares the information to the billing company becomes covered entity as an auxiliary to that ambulance service. Even though they are not even dealing with the patient, they still owe the patient the same duty. It defines what information is covered under PHI, or what is protected health information. And it talks about things that we have to do or else we can get a fine. Now, the simple version of this, it talks about how a covered entity or an ambulance service or a healthcare provider must handle, protect, disclose, share a patient's PHI. So your PHI needs to be protected by these entities. If you are the patient going to a doctor's office or a hospital, you would be the patient, they would be the covered entity, and they would have to take care of and manage your PHI or your protected health information in certain ways and with certain guidelines. If you are working on an ambulance as the provider and you get information from the patient, that is their PHI, and HIPAA governs how you must handle it and how your organization must handle it. Now, HIPAA states we must have a HIPAA policy and we must follow or enforce it. Now, we look at what is PHI. I've used the abbreviation a lot. PHI, of course, would be the patient's name and address, the date, phone, fax number, email address or IP address, anything that can be used to track them electronically, their social security number, their medical record number, their account number, their insurance number, vehicle information, tag, VIN number, anything that can be used to identify them by vehicle, any biometric indicators, facial pictures, web URLs, and a zip code that is more specific than the first 3 digits. You can give out the first 3 digits, it's not PHI. However, anything more specific than that would be considered to be within the realm of PHI. If we get any of these information, or any of these pieces of information from a patient, they fall under HIPAA, and therefore we need to manage that information in accordance with HIPAA. Now, the first step to doing that is the Notice of Privacy Practices. These should be given to every patient from whom you get PHI. You should also get a signature stating that has been received by the patient. HIPAA can come in, the Office of Civil Rights, i.e. the HIPAA cops, can come in and they can say, we need to see documentation from every patient from June 1st to June 30th that they received their PHI notices or the Notice of Privacy Practices. You should be able to provide documentation for signatures from all of these patients. Now, the good thing is, one Notice of Privacy Practices is good for life, unless, however, the notice changes. So let's look. We transport Sammy Smith 3 days a week to his wound care appointments. Now, we all know we've transported Sammy a bunch of times. Do we need to give Sammy a notice every time we transport him, like 2 a day? No, probably not. We know that he received one a while back, and unless that notice changes or is updated, that one notice and that one signature we got from him way back when is good forever. Now, if there is an update or a change to the Notice of Privacy Practices, it should be given to every patient. Again, anytime there's an update. Now, I know that many organizations may have separate HIPAA signature forms, but the vast majority typically have a line somewhere on their billing form that when the patient signs the billing form to allow us to process their ambulance service claim electronically, it also states that they have received their Notice of Privacy Practices. The thing is, if we get lazy about getting signatures, if we have a first-time patient and we don't get a signature on the billing form and we don't give them the Notice of Privacy Practices, technically that is a violation. Now, it's one of the simplest forms of violation, but it's also one of the easiest for the HIPAA cops or the Office of Civil Rights to bust us on. Secondly, it requires that we have administrative safeguards in place. Again, I mentioned a written policy and procedure should include management oversight of safeguards. All entities should have a designated privacy officer. This will identify who will have access to PHI, and typically only those people with a legitimate medical need for access to it should have access to it. It has required training programs for all personnel who have access to PHI. It may have a data storage or a backup policy, how data is stored, how it's backed up, where it's backed up. Internal audit logs should also have procedures for addressing and reporting data breaches and procedures for patients to access their PHI. If a patient wants to access their PHI, yes, you are required to allow them to do it. Now, there can be reasonable fees and reasonable requirements as far as when and where and how. However, you are required to make this readily available to them within reason. So again, we need to know we should have all this in place. If we don't, it would be a great starter project for you to work on for your organization. Now, when we talk about physical safeguards, who has access to or controls for databases, for hardware, for software? How we remove and dispose of old hardware. Now, if you have a computer system that has a bunch of patient records on it, and you get a new computer in and you copy over the hard drive and upload everything to the new machine, if the old machine still has PHI on it, and you say donate it to the local thrift shop or whatever else, you have just had a HIPAA breach. I love the cartoon here. Somebody threw out all these old medical records in the trash. Can we just recycle them for scrap paper? Now, well, that's a little bit excessive. After a certain number of years, many agencies, they retain records for a while, 5 to 7 years, and after that, they get rid of them. They need to be put through a shredder, whether you do it internally or you hire a third-party entity to do it and come in and shred it, and you'd have documentation of their bona fides and their contract. Otherwise, that is a HIPAA breach. Think about it. Would you like your old medical charts to be floating around out in some dumpster and someone find it? Maybe have your social security number on it, your address, your date of birth. Who knows? They could buy a condo in your name, or may just take out a loan in your name. We wouldn't want this happening, so again, we need to make sure not only that we secure it, but we dispose of everything properly. Workstation location and use is a big thing. Any computer that's open access to an entity, we need to make sure that people sign out of them when they walk away from them. Leaving a workstation open and signed in, definitely an issue. Now, let's talk about some of the technical safeguards. Record of access to records. Anyone who has your PHI, or if you have their PHI, if they want to know who accessed it, we need to be able to tell them, yes, these people accessed it, and here was the reason. Typically, that requires some type of network data encryption to avoid hacks. Sometimes two-way network authentication for uploads. Timeout and logout systems. Like I said before, a computer that's open, wide open to the public, that has PHI on it, or if something gets left open in an office, if someone can just walk up and access it, that would be a potential breach right there. Many times we'll have multiple fields required for access of info in the database. We don't just want the name, we also want to have the patient's name and say a secondary characteristic, their date of birth, or the last 4 digits of their social, or the last 4 digits of a phone number. And we've gotten away a lot from using socials these days. We may have, some other, some other requirement as far as two-factor authentication to access through the patient's record in the database. Now, I mentioned who enforces this, the HIPAA cops. Well, yeah, And the HIPAA cops are based on the U.S. Office of Civil Rights. They answer to the Secretary of State, and they do have full investigation and enforcement authority nationwide. If they come in on a HIPAA investigation or a HIPAA citation with your organization, you can definitely be in a lot of deep doo-doo. I think that's the technical word. So now let's look at the possible penalties for messing this up. Well, types of violations. Commonly, an accidental disclosure by an individual can be $100 per violation, up to $50,000 per violation. And second violation that's not due to willful neglect could be $1,000 up to $50,000 per violation. Now, if you have willful neglect, it could be up to $10,000 to $50,000 per violation. And willful neglect that's gone uncorrected, they can charge $50,000 per violation. So let's say, what would an accidental disclosure by an individual be? We get a face sheet from a hospital after transporting a patient in, and we accidentally leave it in the truck, and a subsequent inspection, a HIPAA person or a Office of Civil Rights person finds that there's 2 or 3 face sheets accidentally left in the truck, not secured, not enclosed in any way. Well, that would be a $100 fine to $50,000 per violation. So yeah, 3 sheets after a busy day, 3 face sheets, $300 minimum fine. Now, they don't always impose all these fines, but they can, and it is potential. So let's look at some of the big common violations, things that will get us in trouble. Improperly using or disclosing PHI. An agency not having safeguards of PHI. Improper sharing or disposal of PHI, and disposal is a big one. Anything that has any of that PHI information on it doesn't go in regular general old trash. It either goes in a secure trash can that goes to a third-party shredding service, or should have a shredder available. I know when I worked at one entity, we had a shredder in every station. Any face sheet from a hospital had to be put in there. In theory, someone could come in, do a HIPAA inspection, and say, oh, these 5 face sheets were laying around out in public, unlocked, unsecured, here's 5 violations. Another one is transmitting PHI to the wrong person. This comes in a lot of time with faxes, and we'll talk about faxes a little bit more here in a little bit. If you are faxing to an entity, you need to make sure that the fax number you're faxing to is correct. Many organizations actually pre-program their fax system now, so that way no one can accidentally transpose anything. They can accidentally mess up a number or have a wrong area code, and they tell people only fax to the pre-programmed numbers, which we're sure are properly secured at the receiver's end. Another one, I've seen an entity get hit with this, failure to hand out HIPAA notice of privacy practices. And of course, we can have really interesting violations, social media. Now, I know the picture there is cute. The cat was shocked and outraged. Poor Max to find the cell phone pictures of his neuter procedure posted on a vet's Facebook page. Now, none of us would do anything like putting anything with a patient on our Facebook, would we? Would we put our patients on Facebook? Well, folks, it happened. Now this, I'm not doing on this to pick on these 2 individuals. You know, they, I'm sure, have done plenty themselves as far as picking on themselves and beating themselves up over this. These paramedics out of Florida ended up arrested and charged with multiple felony level charges for taking selfies with patients in the back of ambulances. Now, if the patient was okay with the selfie, signed a release, and everything was wonderful, that's great. That would actually be legal as long as the patient has signed a release of their information and you had their permission to disclose it. But some of these patients were unconscious. So yes, paramedics took selfies with unconscious patients, sent them out on social media back and forth to each other as part of a selfie war. Congratulations, folks. That was your career. Most likely, they won't be doing any EMS stuff anymore. And, I mean, you can read the article here. I don't even want to go through it. You hear this stuff, and it is what it is. But again, social media. Now, less common violations in administrative side. Failing to provide a patient with their records. Agencies should have a policy. If a patient wants to inspect their PHI, they have to have a policy for it, and they have to file it. Again, failing to clean or scrub hard drives on deactivated computers. Failing to report breaches in a timely manner. Yes, if you have a PHI breach, let's say you accidentally lose a computer that had a bunch of PHI on it, or you have someone break in and steal a bunch of PHI out of your office, or a former employee tries to use a bunch of PHI to start an home oxygen business, or anything like this. Not only should you report it, you are federally required to report a breach in a timely manner, as soon as possible, but no longer than 60 days. Understandable, as the first you're realizing this, you may need to investigate it. You may need to determine the scope of it. You may need to determine that it really happened, and is this really what's going on? But you've got 60 days to do that, and this will likely trigger a federal inspection or a state-level inspection. Another big failure is failing to have a risk analysis, not looking at how you handle or manage PHI. So, we've talked about all the stuff that we can't do and all the bad stuff and all the stuff that will get us in trouble and potentially be career enders. What can we do with it? Well, we can share PHI with other providers who are involved directly in the patient's care. For example, if you are on a BLS truck and you have an ALS unit come to back you up, you can share any of this PHI with the ALS crew to whom you're turning the patient over. Or if you take the patient to the hospital, you can share this information with the providers who are involved in the patient's care in the hospital, typically the nurse or the ER doc you give a report to. You can document it thoroughly in the EPCR, and you should. You can share it with law enforcement or court agencies if subpoenaed, as in a federal court subpoena, or in cases of geriatric, child, or elder abuse and neglect, there's usually in your state reporting law an exemption for you to be able to share this information. You can also secure it and destroy it when you're done with it. Again, don't leave patient records lying around anywhere that anyone not involved directly in the patient's care could put their hands on them. Now, you can also share this information with quality assurance or quality improvement personnel. For example, if a training officer or someone was to reach out to you from your agency and said, I'm going over your QA on this call you ran, can you tell me more about it? It's perfectly legit to share it. You may actually use redacted information for training purposes. For example, an interesting case that you run, you can use it, however, you need to redact it and eliminate the patient's PHI out of it. So you can say, we went to a house for a 37-year-old male with chest pain. You can't say we went to Will Smith's house for a 37-year-old male with chest pain. So again, you can redact it and use it for training purposes. In the case of an exposure or possible exposure to a communicable disease, it can be shared within the infection control staff. They need to be able to determine who that patient is and confirm it so they can manage your exposure. You can share it with your billing staff as needed for processing of billing and claims. Again, if you have an internal billing office, that's fine. If you have a third-party billing office, that third-party office would have a business agreement or a business associate agreement with your organization, and thus they'd be able to access your information, and that would bring them in under your HIPAA umbrella. Now, so we can share it, but how? Well, face-to-face conversation, of course. Provider A can tell provider B anything they need to, and they're turning that patient over, and they should. That's part of our job, giving full, adequate reports. However, be aware of your voice and your surroundings. Would it be a disclosure, even an inadvertent or unintentional disclosure, if, let's say, he was telling her and giving a report that the patient inside the house had overdosed, or the patient inside the house was positive for some type of disease, and let's say there was a neighbor standing behind and heard the whole thing. That neighbor, even though he was talking to her, not talking to the neighbor, that would be an inadvertent disclosure by accidentally letting that information get out. So be aware of your voice and your surroundings. We can share it, but we have to share it carefully. How about phone conversations? Can you use a phone? How about a cell phone or a landline? Yes. Again, be careful about unintentional disclosures. Who's standing behind you? Who's standing around? Who's eavesdropping? Who could hear what in a hurry? How about on the radio? Now, radios, some of them are more or less secure than others. We know some are encrypted, some are simplex, but can we use, say, a radio calling the hospital, even if it's not encoded or encrypted and there's no super secret squirrel stuff on it? Yes, we can. We can do it up to the extent needed for patient care. One of the rules in HIPAA and one of the specifications is if we need to share information, while we need to be careful about inadvertent disclosures, they still want patient care to come first. So, for example, we're taking a patient to the hospital and we're trying to help them find the patient's chart and possibly pull an old EKG to look at what's going on because the patient's having some cardiac events. And they say, well, we need that patient's, initials and last four of their social security number. Yes, we can share that. We could share any of the information needed that we need to do for patient care. We cannot just share it for the sake of sharing it. But if there is a medical reason that you can justify, great, fine, no problem. We're doing it to improve patient care and patient outcome. How about faxing it? Can we fax it? Yes, we can fax it. But again, like I said earlier, be careful who you fax it to. This poor guy here got his test results sent to a veterinarian, and the veterinarian apparently recommends dewormer. Who'd have thought it, right? And the interesting part, this cartoon was written in 2010. How about email? Can you email medical records, medical information? How about scanning something into an email and sending it? Well, yes, but only if you are using a secure email system and sending to a secure email system. Now, any of these wonderful emails out there, you may have your Xmail or Yahoo or whatever. Those are not secure email systems. If you think about it, if you scan that patient's records into the computer and you email them, you don't actually send them from point A to point B. They still reside out there somewhere on a server. So you send them to whatever server. Let's say your other colleague had some information about a patient, they sent you something. It can still be found in their sent box on that server, and it can still be found in your inbox on that server, and it could potentially be intercepted along the way. Emailing records, like I said, can be done, but make sure not only that you're using a secure email system on your end, but that you are emailing to a secure email system. If either one of those is not true, that would be a violation, and you can definitely get cited for that, and I've seen it happen. Where do we go from here? Well, number one, let's be HIPAA aware, not only for yourself, but your coworkers, your agency. If you look at what some of these fines are, they can be devastating. Think about what you do every day, your practices and your operation, and think about what damage your organization would suffer if they got a $50,000 fine. What would that do to your budget? What would that do to your staffing? What would that do? And would you want to be the one responsible for that? Think about it again, being HIPAA aware. Most of these disclosures were really, really simple. We need to prevent simple stuff like that, and we need to manage patients' PHI properly. Now, I like this one here. You won't believe who just came in to report a breach of sensitive personal information. Santa got hacked, or maybe it was Santa's information that got out. A patient can go and file a HIPAA complaint, and I've seen it happen. A patient whose medical records or medical information somehow got out in the rumor mill, they filed a HIPAA complaint. Immediately, that hospital was actually investigated extensively, and while they were going through this investigation, they had investigators from the Office of Civil Rights in the ER 12 hours a day, checking to make sure that patients from incoming ambulances had received their notices of privacy practices appropriately. Now, they've got an unlimited budget pretty much to investigate us and conduct studies like this. So again, let's stay out of their sights. Let's make sure we're doing it and we're doing it right. In closing, although tradition has always told us that we maintain patient confidentiality, HIPAA has formally codified that into law. It makes clear that providers and agencies are responsible for not only handling patients' information appropriately, but non-disclosure. And again, although implementing HIPAA programs may be the responsibility of the management, these programs are useless if field-level providers don't buy in and adhere to them. And in many cases, field-level providers would be the ones who would likely notice where a breach is or would be or could potentially result. So please, for the good of yourself and your organization, work to try to be not only HIPAA compliant with the letter of the law, but also the intent of it. Manage your patient's information properly. Destroy old information. Again, many of the biggest breaches and the biggest fines I've seen have been simple stuff that has not been done properly. Hey there, I'd like to thank you all for stopping by, checking out our video. If you want more information about our company or any of the stuff we do, you can check out our website. If you need EMS continuing education hours, we do have our online education platform posted up there. Also, we have our email address if you have any questions. You can find us on YouTube, Facebook, Twitter, and Rumble. We maintain channels on all of those. Also, please like, share this out to your friends, subscribe, help support the channel, and we'll keep putting more videos out there for you. Oh well, enough about that. I know what I'm up for. Time for a cup of coffee. Y'all have a great day. Be safe out there. Bye.